I'm doing my focus assessment on the cardiovascular system. So I'd first ask my patient any past medical history. Do you have a history of hypertension, high cholesterol, or diabetes?
No.
No? Do you have any chest pain, shortness of breath, fatigue, palpitations, or weight gain?
No.
Do you have any family history of hypertension, diabetes, high cholesterol, or cardiovascular disease?
No.
Are you taking any medications?
No.
Do you have any allergies?
Just outdoor allergies.
And then can you tell me about your employment? Where do you work and what do you do?
Yeah, I'm a pipe fitter.
And do you smoke or drink alcohol?
No.
Have you had any past surgeries or treatments?
Never.
Never. And then can you tell me a little bit about how you perceive your health?
Yeah. Have good eating habits, work out.
Getting enough rest and sleep at night?
About 6 to 7 hours a night.
Okay. So after that, I will begin my assessment. So general, I would do, their vital signs, their height and weight, their mental status, level of consciousness, have them rate their pain. And then I'd first inspect the color, temperature, movement, and sensation of like their arms, hands, legs, and feet. Making sure it's all normal color, normal temperature, they're able to move and they can feel. And then I'd also note if their legs are down or up for peripheral vascular and peripheral artery disease. And then I'll look at their fingers, look at the color, temperature, if there's any clubbing. And then I'd also check the capillary refills on all fingers. You want it less than 30 seconds for all of them. Note any edema in their legs or arms. So just kind of press. I'd also want to look at their feet, if they have any ulcers on their feet. Any abnormalities like cyanosis, rhubarb, hematomas, ecchymosis. I think that's paler. I don't remember if I said that one. And then I look at their neck for any jugular vein distensions. Looks good. Okay, and then I will auscultate the heart sounds. So I'd start at the aortic, which is the right second intercostal space, and then move to the pulmonic, which is the left second intercostal space, down to the third intercostal space for Erb's point, down to the fourth intercostal space for the tricuspid, and then mitral is like the fifth intercostal, about midline. And then this is also the apical pulse, so I'd want to listen to that for a full minute, noting any abnormal sounds like murmurs or whooshings, making sure I hear the lub-dub. If I hear like lub-dub-D or D-lub-dub. So that's that. And then palpate. I can put my hand on the apical pulse, feeling for any thrills. And I can also do that for, the whole chest. And then I would want to check their pulses. So, nope. So the carotid pulse, you want to do one at a time. And you want to note rate, rhythm, and amplitude, and compare the sides. So I do the carotid, check the brachial, and then radial, and then femoral, which is, by the thigh and by the groin. And then the dorsalis pedis, And then the posterior tibial. And then I think that's about it.